Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, today we are wrapping up our series on which medical coding certification is the right certification for you. Today I want to talk about the CCS. Remember, I started this series saying that medical coding certification demonstrates a professional's ability to classify medical data and code for reimbursement. There are several medical coding certifications available. The most widely recognized, let me stress this again, because there are a bunch of programs. There are a lot of, I call them fly-by-night programs that claim to be able to teach you coding in 2 days. No. So this series covers the most widely accepted. Check job ads, see what certification they're looking for in your area. But the most widely recognized and considered best certifications for medical coding are the CPC, CCA, CCS, and CCSP. Now, we've already talked about the CPC. That's the AAPC outpatient certification. We talked about the CCA, which is the inpatient intro certification offered through AHIMA, AHIMA. And now today I want to talk about the CCS. All right. The CCS certification is designed for individuals skilled in classifying medical data from medical records. CCS professionals demonstrate a practitioner's tested skills in data quality and accuracy, as well as mastering of coding proficiency. So that's why I say this CCS is the highest medical coding certification that there is. Now let's talk about the CCS exam. There are 107 questions on the CCS exam. 97 are scored and 10 are what they call pre-test items. Now the 10 pre-test questions are randomly distributed throughout the exam. They're not at the beginning, they're throughout the exam. And pre-test questions are mainly for data collection purposes, and they do not count toward the candidate's score. You have 4 hours to complete this 107 question exam. And you must use the current year book when testing. So it's 2025 now, you must have 2025 code books. The CCS exam is computer-based, and it must be scheduled at a Pearson VUE testing center. They don't offer the remote testing yet at home, or that you have to go to a Pearson VUE testing center. The passing score for the CCS is 300. And unlike the CPC exam, should you have to retake the exam, you must wait 30 days and then pay the exam fee all over. The price of the CCS exam is $299 for AHIMA members and $399 for non-AHIMA members. And in test retakes are the same as the cost for the exam. I wanted to share with you the domains of the exam. First of all, I'm sharing with you here the AHIMA website, and look at all of AHIMA's certifications. And today we're talking about the CCS right here. But the domains for the CCS are 1, your coding knowledge and skills; 2, coding documentation; 3, provider queries; 4, regulatory compliance; 5, information technologies; and there are CCS medical scenarios on the CCS exam for you to code. So, to maintain, not just test, but then to maintain your CCS credential, you will need to complete all of the recertification requirements over a 2-year certification period. So every 2 years, you're up to turn in your CEUs and pay the recertification fee. And remember, now with AHIMA, there's a recertification fee and there's a membership fee, 2 separate fees. They used to be included under one, but now they've got it where you pay 2 separate fees. So again, guys, the goal that I wanted to share with you about certification is to just remind you that there are so many certifications out there. You got to be careful. So many schools out there claiming to be medical coding schools. Do your research. Look at newspapers or ads or when recruiters call, or any position that you're interested in. Look at employers' job boards and see which certification they're looking for if you're interested in becoming a medical coder. I've heard of different organizations other than AHIMA and AAPC that offer credentials or certification for medical coding. And I'm just kind of amazed because, one, I had a student tell me, oh, I'm going to get my degree in medical coding. You don't need a degree for medical coding. You need to be certified. So it's a certificate, not a degree. And then I'm hearing about medical coding programs that are costing $45,000. How can some schools offer a 7 to 14 week medical coding program for less than $1,000? Others might offer a little more in depth. Each one of my classes are 12 weeks long because I have to teach the way that I learn, and I have to really analyze the material. I present the material at the beginning of the week. We work on exercises. We review the cases. I want my students to better understand what's going on. Then we take a quiz in addition to our homework assignment, and we just stay within 1 or 2 chapters a week because I need that information to sink in and not just rush through it. So when I hear about these quick coding programs, ding, ding, those are concerns. When you have a quick coding program, how are you retaining that information? So think about this. Now, in addition to the CCS, there is what's called the CCSP. So there's 2 sides. CCS, CCSP, physician. That is the outpatient CCS certification. I like to say that CCS is the highest medical coding certification there is. And looking back, I do have the RHIA, which is the highest AHIMA certification. But if I had to do it all again, I would get certified with the CPC through AAPC for outpatient coding. I'd start there. But I wouldn't stop. I want that inpatient certification as well so that I can work anywhere. And so then I would go on, after the CPC, I would go on and get my CCS. Now, this is just my opinion, but that covers you as far as inpatient or outpatient coding. And also keep in mind, with the CCS, in addition to CPT coding, you also have to learn ICD-10 PCS. Remember, ICD-10 PCS is for inpatient procedures. CPT is for outpatient, the professional side. Like I tell my students, there are 2 sides to coding. Facility, like the hospital itself, that's ICD-10 PCS so that they get their check. And then there's CPT, so that the physician gets their check for performing the procedure. Hospital gets a check for allowing the patient and the physician to use their operating room, their resources. And then it takes a physician to perform the surgery. You capture their procedures with CPT. So remember, with the highest certification there is, this CCS, you will need both classifications in addition to the ICD-10 and the HCPCS and the other domains that I showed you just now. There's a whole lot more to the CCS exam than coding. All right, guys, thanks. I'll see you in the next one.